Have you ever heard someone say, if you don't want kidney stones, stop eating calcium? It's one of the most common pieces of health advice people give, but is it actually true? The answer may surprise you. Many people believe that because the most common kidney stones contain calcium, eating calcium-rich foods must be the cause. As a result, they stop drinking milk, avoid yogurt, or even stop taking calcium-rich foods altogether. But according to medical research, the relationship between calcium and kidney stones is much more complicated than that. In fact, for many people, getting enough calcium from food may actually be part of a healthy eating pattern that supports kidney stone prevention. So, what's the real story? In today's video, we'll separate myths from facts and explain what science really says about calcium, kidney stones, calcium supplements, hydration, and the foods that may influence your risk. Be sure to stay until the end because we'll also reveal 5 of the biggest myths about kidney stones, and one of them may completely change the way you think about calcium. Let's get started. Kidney stones are incredibly common. Millions of people around the world will experience at least one kidney stone during their lifetime. If you've ever had one, you probably remember the pain. Many people describe kidney stone pain as one of the most intense pains they've ever experienced. The good news is that there are healthy habits that may help reduce the risk of certain types of kidney stones. However, before making major changes to your diet, it's important to understand what actually causes kidney stones. One important point to remember is this: not all kidney stones are the same. Different types of stones have different causes. Likewise, not everyone's dietary recommendations are the same. That's why today's video focuses on understanding the science rather than believing common myths. Let's begin by understanding what kidney stones actually are. Your kidneys work around the clock. Every day they filter your blood, remove waste products, balance minerals, and produce urine. Normally, waste products dissolve in urine and leave the body without causing any problems. But sometimes, certain minerals and other substances become highly concentrated. When this happens, tiny crystals can begin forming inside the kidneys. Over time, those crystals may stick together and grow into hard deposits called kidney stones. Some stones remain very small. Others become large enough to block the flow of urine. When a stone moves through the urinary tract, it may cause symptoms such as severe pain in the back or side, pain that travels toward the groin, blood in the urine, nausea or vomiting, frequent urination, pain during urination. If a kidney stone causes severe pain, fever, chills, vomiting, or difficulty passing urine, it's important to seek medical care promptly. Kidney stones are not caused by one single factor. Instead, several things can influence risk, including not drinking enough fluids, high sodium intake, certain medical conditions, family history, obesity, some medications, certain dietary patterns. That's why prevention often involves several healthy habits working together. Many people think there's only one kind of kidney stone. Actually, there are several different types, and understanding them is important because prevention strategies can vary. 1. Calcium oxalate stones. These are the most common type. Despite the name, they don't automatically mean that eating calcium caused the problem. We'll explain why in just a moment. 2. Calcium phosphate stones. These stones also contain calcium but may be linked to different medical conditions or changes in urine chemistry. 3. Uric acid stones. These stones are different from calcium stones. They may occur more often in people with certain metabolic conditions or very acidic urine. 4. Struvite stones. These stones are often associated with urinary tract infections. They can grow quickly and become quite large if not treated. 5. Cystine stones. These are uncommon and usually occur because of a rare inherited condition that affects how the kidneys handle certain amino acids. As you can see, not all kidney stones are caused by the same factors. That's why it's so important to know what type of stone you've had before making major dietary changes. If you pass a kidney stone, your healthcare provider may recommend having it analyzed to determine its composition. That information can help guide personalized prevention strategies. Now we come to one of the biggest misconceptions. Many people believe that because the most common kidney stones contain calcium, they should stop eating calcium-rich foods. But for many people, that's not what current evidence suggests. Here's why. Many calcium oxalate stones form when calcium and oxalate combine in the urine. Oxalate is a natural substance found in many foods, including spinach, rhubarb, beets, nuts, chocolate, tea. When calcium and oxalate meet inside the digestive tract during a meal, they can bind together before being absorbed. That means less oxalate may enter the bloodstream and eventually the urine. For many people, this is one reason why getting enough calcium from foods can be part of a balanced eating pattern. In contrast, avoiding calcium-rich foods without medical guidance may not reduce stone risk, and in some cases, it may even have unintended effects on bone health. Calcium is essential for many important functions in the body. It helps support strong bones, healthy teeth, muscle contraction, nerve function, normal heart rhythm. As we age, maintaining adequate calcium intake becomes even more important because bone density naturally declines over time. This is especially true for older adults who may already be at increased risk for osteoporosis. However, that doesn't mean everyone should consume large amounts of calcium. The right amount depends on your age, health conditions, medications, and personal medical history. If you've had kidney stones before, your healthcare provider or registered dietitian can help determine the most appropriate eating plan for you. The key message is simple. Don't assume calcium is the enemy simply because calcium is found in many kidney stones. The science is more nuanced than that. Now let's answer another important question that many older adults ask. What about calcium supplements? Calcium is an essential mineral. Your body needs it every single day to support strong bones, healthy teeth, muscle movement, nerve function, normal heart rhythm, blood clotting. As we age, getting enough calcium becomes even more important because bone density naturally decreases. This is one reason many adults over 60 take calcium supplements. But are supplements the same as getting calcium from food? Not exactly. For some people, calcium supplements may affect kidney stone risk differently than calcium obtained naturally through meals. Researchers are still studying this relationship, and the answer depends on factors such as the amount taken, when it's taken, and an individual's overall health. Some studies suggest that taking large amounts of calcium supplements without food may increase the amount of calcium that ends up in the urine for certain people. That's one reason healthcare providers often recommend taking calcium supplements with meals if they are needed. However, this does not mean calcium supplements are unsafe. Many people benefit from them, especially if they have difficulty meeting their calcium needs through food or have conditions such as osteoporosis. The important message is this. Don't start, or stop, a calcium supplement on your own simply because you heard it causes kidney stones. Instead, talk with your healthcare provider. Review all of your medications and supplements. Follow the recommended dosage. Avoid taking more than instructed and less specifically advised. Remember, more isn't always better. Whether it's vitamins, minerals, or supplements, taking excessive amounts can sometimes do more harm than good. A personalized plan is always better than guessing. If calcium from foods can be part of a balanced eating pattern, where should you get it? Fortunately, many everyday foods naturally provide calcium. Here are some common examples. Milk is one of the best-known calcium sources. It also provides protein and several other nutrients. For many people, low-fat or fat-free milk can be part of a healthy diet, depending on individual nutritional needs. Yogurt is another excellent source of calcium. Many varieties also contain live cultures that support digestive health. Choose plain or lower added sugar options when possible, and add fresh fruit for natural sweetness. Cheese contains calcium, but it can also be high in sodium and saturated fat depending on the type. Enjoying cheese in moderation can help you balance nutrition with flavor. Some soy, almond, oat, or other plant-based beverages are fortified with calcium. If you choose these products, check the nutrition label to make sure they provide added calcium and other nutrients. Certain types of tofu are prepared using calcium salts, making them another useful source of calcium. Always check the packaging because not all tofu contains the same amount. The goal isn't to focus on one food. Instead, think about building balanced meals throughout the day. For example, breakfast might include yogurt with berries. Lunch could include a salad with vegetables and grilled chicken. Dinner might feature baked salmon, steamed vegetables, and a glass of milk or a fortified beverage. Healthy eating is about the overall pattern, not one single meal. Now let's talk about another word that's often mentioned alongside kidney stones. Oxalate is a naturally occurring substance found in many plant foods. Most people can eat oxalate-containing foods without problems. However, for some individuals who are prone to calcium oxalate kidney stones, oxalates may play an important role. Foods that naturally contain higher amounts of oxalate include spinach, rhubarb, beets, Swiss chard, almonds, peanuts, chocolate, cocoa powder, black tea. Seeing this list sometimes causes people to panic. They think they must eliminate every one of these foods forever. Fortunately, that usually isn't necessary. Many of these foods are highly nutritious and provide valuable vitamins, minerals, fiber, and antioxidants. Instead of eliminating them automatically, healthcare providers often recommend focusing on overall balance. For some people, eating calcium-rich foods during the same meal as oxalate-rich foods may help because calcium can bind to oxalate in the digestive tract before it is absorbed. This is one reason why individualized advice is so important. Another helpful habit is staying well hydrated throughout the day, because concentrated urine can make stone formation more likely. We'll discuss hydration in detail in the next section. It's also worth remembering that sodium intake plays a role. A diet very high in sodium may increase the amount of calcium lost in the urine in some people. That's why reducing heavily processed foods and choosing more home-cooked meals can benefit overall kidney health. The key takeaway is simple. Don't fear healthy foods. Instead, work toward a balanced eating pattern that includes a variety of fruits, vegetables, whole grains, lean proteins, and appropriate calcium sources based on your individual needs. At this point, we've learned several important lessons. Calcium is essential for many body functions. Calcium from foods is not automatically harmful for people concerned about kidney stones. Calcium supplements should only be used as recommended by a healthcare provider. Oxalates are naturally found in many healthy foods. The balance between calcium, oxalates, hydration, and overall diet is often more important than avoiding a single food. Understanding these principles helps replace fear with informed choices. Instead of eliminating nutritious foods unnecessarily, you can focus on habits that support both kidney and bone health. We've covered a lot of important information so far. Now let's finish by talking about one of the most effective lifestyle habits for many people who want to reduce their risk of kidney stones. If there's one habit consistently recommended for many people who are prone to kidney stones, it's staying well hydrated. Why? Because when you don't drink enough fluids, your urine becomes more concentrated. Think of it like making a cup of tea. If you use very little water, everything becomes more concentrated. The same thing can happen with urine. When minerals become highly concentrated, they're more likely to form tiny crystals. Over time, those crystals can stick together and become kidney stones. Drinking enough fluids helps dilute the urine, making it more difficult for crystals to form. For most healthy adults, water is the best choice. Some people like to carry a reusable water bottle throughout the day as a reminder to drink regularly. Others find it helpful to drink a glass of water when they wake up, with each meal, before going for a walk, after exercise, during hot weather. These small habits can make hydration feel effortless. However, it's important to remember that not everyone should dramatically increase their fluid intake. People with certain medical conditions, such as heart failure or advanced kidney disease, may be advised to limit fluids. Always follow the guidance of your healthcare provider regarding the amount of fluid that's appropriate for you. Another easy way to monitor hydration is to pay attention to the color of your urine. For many healthy people, pale yellow urine often suggests adequate hydration, while darker urine may indicate the need for more fluids. However, certain vitamins, medications, and medical conditions can also change urine color, so it isn't a perfect measure. Hydration is important, but it's only one part of the picture. Several other daily habits may also help reduce the risk of kidney stones. A diet very high in sodium may increase calcium levels in the urine for some people. Try reducing processed meats, fast food, salty snacks, instant noodles, canned soups with added salt, frozen convenience meals. Cooking more meals at home makes it easier to control how much sodium you eat. Protein is essential for maintaining muscle and overall health. However, some people who consume very large amounts of animal protein may increase their risk of certain types of kidney stones. Rather than avoiding protein, focus on balanced portions and include a variety of protein sources based on your healthcare provider's recommendations. Regular physical activity supports overall health by helping maintain healthy body weight, healthy blood pressure, better blood sugar control. These benefits support your kidneys as well. Even a 30-minute walk most days of the week can make a positive difference. Carrying excess body weight is associated with an increased risk of several conditions that can affect kidney health, including high blood pressure and type 2 diabetes. Healthy eating combined with regular activity is one of the best long-term strategies. If you've had a kidney stone before, don't assume it was a one-time event. Your healthcare provider may recommend additional testing to determine the type of stone, possible causes, personalized prevention strategies. This information can be incredibly valuable in reducing the risk of future stones. Let's finish by clearing up 5 common myths. Myth 1: all calcium causes kidney stones. Fact: many people can safely consume calcium-rich foods as part of a balanced diet. The relationship between calcium and kidney stones is more complex than simply avoiding calcium. Myth 2: stop drinking milk immediately. Fact: milk and other calcium-rich foods may still be appropriate for many people. Eliminating dairy without medical advice can make it harder to meet calcium needs. Myth 3: supplements are always safe because they are natural. Fact: supplements should only be taken as recommended by your healthcare provider. More is not always better. Myth 4: drinking less water protects the kidneys. Fact: for many people, adequate hydration is one of the most important strategies for reducing kidney stone risk. Myth 5: once you have a kidney stone, there's nothing you can do. Fact: many people can reduce their risk of future stones by following personalized medical advice and making healthy lifestyle changes. Let's review today's key lessons. Kidney stones come in several different types. Calcium found in kidney stones does not automatically mean dietary calcium caused them. Calcium from foods may actually help reduce oxalate absorption during meals for many people. Calcium supplements should only be taken according to your healthcare provider's recommendations. Staying hydrated is one of the most effective habits for many people who are prone to kidney stones. Limiting excess sodium, maintaining a healthy weight, staying active, and following up with your healthcare provider are all important parts of kidney stone prevention. The biggest lesson is this: don't let myths guide your health decisions. Let evidence and personalized medical advice guide you instead. It's understandable to feel worried after experiencing a kidney stone. The pain can be intense, and many people fear it will happen again. But instead of eliminating healthy foods out of fear, focus on building consistent habits that support your kidneys over the long term. Healthy eating, regular hydration, physical activity, and routine medical care work together far better than any single miracle food or supplement. Small changes, practiced consistently, often have the greatest impact. If you found today's video helpful, please give it a thumbs up and subscribe to the channel. Every week, we share evidence-based videos designed especially for adults over 60, covering kidney health, healthy aging, heart health, diabetes, nutrition, brain health, simple lifestyle habits. Now we'd love to hear from you. Have you ever experienced a kidney stone? If so, what advice did your doctor give you? Share your experience in the comments below. Your story could encourage or help someone else facing the same situation. And if you know someone who avoids calcium because they're afraid of kidney stones, please share this video with them. Accurate information can help people make healthier decisions. Thank you for watching, stay healthy, and we'll see you in the next video.